Hi guys, I am Angela. I'm a registered nurse at Cadleck, and the following is a short interview regarding our Survey of Technology project.
What topic have you chosen for your survey of technology?
I chose to delve into the use of telehealth, especially in our senior population.
What is telehealth?
Telehealth is the use of electronics and telecommunications, and in doing so and utilizing this decreases office visits for that patient population that it's used in.
How can telehealth enhance communications in senior patients?
So, telehealth can enhance communication between senior patients and their healthcare providers, be that a nurse or a doctor, by allowing them to make phone calls, video chats, use applications, biofeedback sensors and devices like an Apple Watch or a blood glucose monitoring or insulin pump, and other devices. And they can rely on these instead of having to make an office visit.
How can telehealth decrease hospitalizations in senior patients?
So, by using telehealth, instead of waiting to get an appointment, our senior patient population can have a face to face contact with a healthcare provider, be it a nurse or a doctor, whenever they think that something may or may not be going wrong. This way, they can be seen more frequently, and we can focus on promotion of health rather than treating diseases or infections or whatever it may be. Additionally, utilizing the telehealth for our senior population can reduce travel time. It can also help with many of these patients that have limited mobility. And it can also reduce the feeling of burden that many senior patients feel when they think that they might need health care but don't want to bother, be it a family member or somebody to take them or the doctor themselves to figure out what the problem is. In doing all this, they can receive much more prompt care instead of waiting till an upcoming appointment.
What future progress is needed to continue to benefit patients?
A lot of progress needs to be made in technology surrounding telehealth, most of it being the current regulations that are in place. Right now, Medicare only reimburses a small fraction of the use of telehealth, primarily for strictly homebound patients. Also, there are old state and federal regulations that are completely outdated, that really hamper efforts because of laws surrounding privacy laws and HIPAA. And most of all, the telehealth services are lessened because of our wireless and broadband availability for these patients. Normally, we utilize home health care and things for our patients that live in rural areas or can't get to the doctor because of limited mobility. Well, it's those rural areas that also have limited Wi-Fi or broadband capabilities.
How does this correlate locally for our seniors?
Back to those rural areas, a lot of our seniors receiving care here live in outlying areas. They don't just live in Richland, Kennewick, or Pasco. They live in, Burbank, Findlay, Eltopia, out towards Prosser and Grandview. And for them to get to a doctor is an all-day situation. They normally have to get somebody to drive them in and back. So by using telehealth for our local seniors, we can still keep up with their appointments and they can remain healthy and not have to get back and forth to appointments. Additionally, we have a huge cancer care population. I'm actually an oncology nurse, so this correlates to my practice as well. And these patients have to be seen very frequently in the office to check up on not just their labs, but check up on how they're doing, their side effects, their chemo treatments, and for follow-up issues that could be done at home if we could use telehealth and get reimbursed by Medicare for them as well. And thanks. That's all I got.